Hi, I'm Dr. B. I'm a board certified pediatrician and a pediatric critical care doctor. And today I want you to know a few things about pneumonia. So, number one, what is pneumonia? So, it's an infection of the lung tissue and it's different than the airways. So, infection of the airways is called bronchitis or bronchiolitis, and the actual lung tissue getting infected is called pneumonia. Number two, what are the causes of pneumonia? So, it can be caused by fungus, bacteria and viruses, and then viruses are the most common cause of pediatric pneumonias. Number three, how can you prevent it? So this is particularly important if you have younger babies, so 2 month, 3 month, anything under a year old. Good hand washing whenever you handle the child. Wear a mask around that baby if you are sick, and also if you have an older child who is sick. And then the vaccines, they are actually preventative against pneumonias. So like I said, the viruses are the most common cause of pediatric pneumonias. So influenza vaccine can help prevent this. And then 2 of the common childhood vaccines, such as your Haemophilus influenza vaccine and Prevnar, can help prevent against bacterial pneumonias. And then what are the clinical features of pneumonia? So everybody knows that is cough, congestion, sometimes chest pain, and then also belly pain or abdominal pain is actually can be a common presenting finding for pneumonia, and it can get missed. And then how do you treat it? So majority of the pneumonias can be treated in your home, in the pediatrician's office, with oral antibiotics, and the common antibiotics that are used are amoxicillin, Omnicef, Zithromax. Those are some of the common things that you can do as outpatient. However, if they get sick and they need to be admitted, then obviously we do different antibiotics. So, and then few things to watch for and when to go to the emergency room would be one, if they are, especially the infants, if they are poor feeding, and getting dehydrated, and they are also very irritable. If they are working really hard to breathe, so they are belly breathing, really struggling to breathe, that would be. And then also if they're retracting, so you can notice that their ribs are very visible and it's getting sucked in, and you have pulling over here. Any of these things present, or if all of these are present, the child really should be going to the emergency room or being seen by the pediatrician for being treated in the hospital. And otherwise, the child can be treated at home with the oral antibiotics once they're seen by the pediatrician. So that's it. That's my tips for pneumonia. Thank you.